guys, if you want to take a picture of this, right, I'll show you how the actual courses look like, right? But if you get this link, right, this will take you to the pre-course assessment. This is pre-course assessment for ACLS, and you're going to need to print a certificate, right, of completion. So, and I will show you how this looks, right? Once you guys take a picture of this, right? Everybody got a picture, right? So, if you took a picture of this, this is where the link will take you, right? So this is the link, and you see there is two courses, right? There is a ACLS, right, pre-course self-assessment, and there's ACLS pre-course self-assessment and pre-course work. So the difference is this, right? Here on this one, there's also videos, and I would say it goes through, like, as you watch the videos, it will ask you questions. I'll show you how it looks. My advice to you to this one, what you're going to do is you're going to go to that link, you're going to say launch course, it's going to ask you to create an account, right? So you're going to create an account. I'm already logged in, so if I click this pre-course assessment, right, it's going to take me to already, you know, my account, right? Hold on a second. Pre-course self-assessment, right? So we want to do the ones with the videos and pre-course work, right? So this is the one we want, right? I already completed it, but I'll show you how it looks, right? I can review it. So this will be the pre-course self-assessment and the work. So let me show you the work, and this will take you to the videos. Since it's completed, I'm going to have to like backtrack, right? So you see all the lesson plans, right? So let's say we're going to go to, you know, whatever one, so that you guys, let's say science resuscitation, right? And then we'll have we'll have questions, and we'll have some videos. I'll just show you like just a sample, right? How it looks.
This is only. The AHA does not endorse or recommend any specific manufacturer or product.
Unfortunately, you cannot skip
In order to show skills clearly, the healthcare providers in this video do not always use personal protective equipment, such as gloves.
Right? So for every block of it, it will be a video, and then we'll ask you questions, right?
The American Heart Association's systematic approach includes 3 components once you have established scene safety and your initial impression of the patient: the BLS assessment, the primary assessment, and the secondary assessment. These sequences combine assessment and treatment components for effective
a lot of the
resuscitation.
stuff is going to be questions on your actual ACLS exam.
To use for a patient, start with the step we all do automatically.
So it will go through the videos, and I want to just show you. I'm going to show you the what it includes. So it has. This is where you're going to begin. It's going to start with systems of care. You're going to have questions afterwards. Science of resuscitation. Right, it will have the systematic approach. It's also going to have the new role of CPR Coach. I'll explain what that is. High quality CPR, airway management, right? It will have recognition of deterioration, and very important, right? You have coronary syndromes. It will go through all the stuff we need to do. It will also do stroke assessment. There's also the tachydysrhythmias, right? So tachycardias. So this is also very good. It will go through the medications. And the
products are shown for demonstration purposes
right?
only.
So the videos,
the AHA
I would say,
does not endorse or recommend any specific
it will be useful if you
or
watch them,
product.
right? Because it will
In
go
order
through
to
a lot
show
of the stuff that
skills
you will need to know,
The
right?
healthcare providers in this video do not always use personal protective equipment, such as gloves.
And then we'll go through the algorithms. Right, you see?
The tachycardia algorithm simplifies initial management of tachycardia. The presence or absence of pulses is considered key to management of a patient with any tachycardia. If pulses are present, determine whether the patient is stable or unstable, and then provide treatment based on the patient's condition and rhythm. If a pulseless tachycardia is present, manage the patient according to the cardiac arrest algorithm. Implementation of this algorithm begins by verifying the presence of a pulse with the tachycardia. Most symptomatic tachyarrhythmias will present with a heart rate of 150 or more beats per minute. If a tachycardia and a pulse are present, maintain a patent airway and assist breathing as necessary. Provide oxygen if hypoxemic, and monitor cardiac rhythm, blood pressure, and oxygen saturation. Obtain IV access and a 12-lead ECG if available.
And this is the
The
2020
tachycardia
guidelines.
is unstable if
right?
the patient demonstrates rate-related cardiovascular compromise with signs and symptoms such as hypotension, acutely altered mental status, signs of shock,
And we tell you, right, blood pressure less than
chest
90, and all these signs and
and
symptoms.
acute heart failure. Immediate synchronized cardioversion is indicated. If time permits, establish IV access before cardioversion and administer sedation if the patient is conscious. However, don't delay cardioversion if the patient is extremely unstable. Synchronized cardioversion uses a sensor to deliver a shock synchronized with a peak of the QRS complex, the highest point of the R wave. Synchronization avoids the delivery of a shock during cardiac repolarization, a period of vulnerability in which a shock can precipitate VF. Refer to your specific device's recommended energy level to maximize first shock success.
Right.
Check to make sure the synchronized marker is located on the R wave
So
before
right,
clearing
as you see, the
cardioversion
videos
indication.
are not really a waste of your time, right? And like I said, if you go through all these lessons, right, it will show you the video and they will have questions associated with it. The questions that will ask you about the pharmacology, about the algorithms. A lot of these questions are going to be on your not final exam, but the final exam you will take for the ACLS class, which you must score an 84 to pass, right? And they will go through it, right? And then you'll have an actual class with the videos, with all the explanations before you start. But the pre-course work kind of gives you like a ground information, the baseline that you need to know. And after you've done this, so you finish this, is going to give you a certificate. And then this other form I want to show you, right? So this was the one I clicked right now was the course work, and there's self-assessment. For this, you can take it unlimited tries, right? It's basically questions, right? Let me say review, right? So we'll go through the rhythms, right? It will show you a rhythm, and you have to identify it, right? I'm just going to scroll quickly through it, right? And then it will go through pharmacology, right? So it will give you see at the top it says pharmacology questions, right? So we'll go through that, right? And then it will give you cases, right? So they give you practical application. They'll say, you have a patient, so forth, right? This is the rhythm. What you're going to do is your first line of treatment, right? And then once you finish, right, I'm going to exit out this exercise. You will able to basically generate a certificate, which you must bring to the class for you to take the class, not to take the final exam, but just to take the class. So once you download the certificate, once you finish all this, show you how it looks. You want to print this out, you want to bring this in. If you do not have the certificate, right, they will not let you take the class, right?
What class are you talking about?
ACLS, right? It's on your schedule.
It starts in like July.
Huh?
It starts in like July.
Yeah, I think so. But you'll have the ACLS class. But this stuff takes some time to do. So what I'm saying to you is, go to that link, make an account, right? Watch those videos, right? And then you're going to print your certificate once you take your pre-course self-assessment. There's also in the same link you're going to find the PALS, right? The self-assessment. Same thing, videos and the certificates, right? Why am I bringing this to your attention now? Because it's going to take some time. What's probably going to happen is like a couple of days before the class, they're going to tell you to do this, and then you're going to say, I didn't have any time. I'm going to repeat again, so it's very, very clear. You don't bring the certificate, right, for the day of the class, you cannot take the class. Is that clear? How do you get the certificate? You go to the link, you make an account, right? I would watch those videos, and I'll take that self-assessment that I was clicking through. Take it until you get 100, because you can take it in unlimited tries, yeah.
Some of those courses you had to pay. Is that free?
This is free.
That one is free. Okay.
This is free, yeah. This is free, the PALS is free.
18th and 19th.
Yeah.
How many hours would you say?
How many hours? It's like how fast, how fast you go, right? If you answer your questions correctly, right, you can go pretty quickly, right? So it depends. The question quiz is your own pace. You could obviously use the book, and also there's something else here that I would see if I can show you, right? Here on the side, there's resources, right? So you see there is a checklist, right? Pre-course preparation checklist that I'm going to know, and also I'm going to show you the supplementary material. This supplementary material and this is also excellent. So let me just click the supplementary material. in here, right, if once I scroll, right, you have the oxygen flow rates and all that, but the best part about this is this. They show you all the rhythms, and they tell you, right, what's the critical criteria. So they'll tell you VFib, the pathophysiology, why it's VFib, right, and also, right, what it's causing. They show you the rhythm, right, and they talk about, right, what to do, right, H's and T's and so forth. So, and it will go through all these rhythms, right. So here you will see sinus tacks, you will see SVTs, you will see, torsades, you will see all types of rhythms, and we'll tell you the criteria. And this is what something I was, when we started learning rhythms, I was kind of like telling you guys, right? So when we go up here, right? So for example, if we're dealing with ventricular fibrillation, right? I was telling you, is the rhythm regular or irregular? So here it will tell you, right, all the specifics of what's the cause of it, right? What's happening, right? Here they'll tell you the amplitude, they'll tell you how fast that is, right? So I'll show you the rhythms. And then here it will quantify it even further, right? Causes. Here they'll show you a systole, right? No ventricular activity, and no P waves and everything else like that. Here we have sinus tach, right? And it will tell you all the criteria. Here we have EFib, right? So EFib, what's the rate, right? Atrial rate 300 to 400. Here you have atrial flutter. It will say which rhythm is irregular. So AFib, obviously irregularly irregular. A flutter can be regular, can also be irregular. It will tell you the ratios. So it will go through all the parameters, right? And when you're going to be getting your actual test, you're going to see some of these rhythms. So it goes, it will be very helpful if you go through the supplemental material. You go through all these rhythms and the criteria. And you could download this for free, right? And it has all the algorithms that you're going to need. Tachydysrhythmias, right? Cardiac arrest, all that stuff. I would also advise you to buy the book, right? But if you're going to download it, get this. This is the checklist I was telling you about. This here is the checklist, right? Which you want to make sure you've done before you start the class, right? I did the self-assessment. Let me make it bigger. So you did your self-assessment that I showed you. You watched the videos. You're going to print the certificate, right? We're going to also test you on the high-quality BLS competency. I'm going to explain this now, right? You have your manual, the book that you're going to buy, and you did the algorithms, which are found in the book, also found in the supplementary packet on that link, right? Any questions about this?
Yeah, where's the link?
For this?
Yeah.
For this, once you...
Are you emailing it or should we just take a picture?
Yeah, so take a picture. So the link to the supplementary is on the side. The link to this is here, but I'm right here. So you can take a picture of this. Let me make it bigger. So you'll go to this, and then you're going to find the ACLS Precourse Self-Assessment. Right, so once you click this link, it will take you here, right? It will take you, it will take you here, and then what you do is you're going to find this one, ACLS Precourse Self-Assessment and Precourse Work, right? And then you're going to launch this course, and then it's going to take you here. Obviously, you're not going to be able to print any of this until you finish the work. You're going to start your, I would say, start with the videos first. Once you finish that, then you do your exam, the self-assessment. You could take it unlimited times. I'll do it until you get 100. And then you print your certificate, which you're going to bring to the class the day of the class. Hopefully that's clear, right? So this was the old style, right? That they gave you like a score breakdown, right? The new style is you're going to start your assessment, right? It will also tell you in the end what your score is. So what I'm saying is you could take it as many times until you get 100. Why do I say this? Why do I say take it as many times until you get 100?
Practice for the other one?
Yeah, so you will know all the answers, right? So if you're making a mistake in rhythms, right, keep retaking it until you get 100, right? So this way you know the material well, right? So there's two types, I said, right? Take notes with the videos, and we'll go through all the algorithms, right? Radiodysrhythmia, tachydysrhythmia, cardiac arrest management, everything, right? And then obviously you're going to print your certificate. You also get CME, right? If you want to. This will, I mean, for BLS level right now, it's not going to, help you much. But once you become medics, you need to do CME. So when you do your ACLS refresher, you can get your certificates with CME, right? This is something I want to show you so that there's no confusion. Since 2019, right, they said that we want to have feedback devices, right? So all the instructors here who are AHA instructors and ACLS instructors, we're going to look at feedback. I'm going to explain how it looks, right? So this is not like a good thing to have or like something you know nice to know, right? This is a mandatory thing for you to be able to do. Why? Because they said sometimes instructors may not be able to fully gauge depth of compressions or your chest compression fraction. So we're going to use a app-based device, right, on the iPad that's going to sync the mannequin to it, and it will tell us the objective number, meaning what is your performance, right? So then, you know, you're like, no, but I did it, you know, this many times. This is my CCF, right? But the app actually measures, you know, your performance. So you can't really lie, right? If you either did it or you didn't, right? So this is just to show you. This was the updated science summary. Once you watch the videos, it will go through all the science updates. So what is the difference in 2020? So watch the videos, right? And obviously when you actually take the class, you're going to have the actual AHA DVD that's going to go through all of it, right? So explain. I'm just going to overview some of these things. This here, if I go to the instructor network and I download the checklist, like the checklist that we're going to be testing you on, right? And I download them, it will show you some of these things. So it says compression, right? The arrows point, it says audio-visual feedback device required for accuracy, right? And it will actually say, right, that you perform continuous compressions, right, at a rate of 100 to 120 a minute, right? And it says shocks within 45 seconds of AED arrival, right? So we actually making sure you actually done this, right? You didn't verbalize, so you're utilizing the proper equipment and you're doing all this, right? Before these app-based devices, some instructors use this timer, and that was the proper thing to do. But now we have the audio-visual feedback, right? Here you notice for the airway management skills, that's going to be part of the ACLS, right? It has also insertion of the nasopharyngeal airways and ventilation. Make sure you know how to size them, right? It goes through the videos. Make sure you look at supplementary material. So if the instructor asks you, right, you know, you have this patient, he has airway compromise, what device you want to employ, you select the appropriate device. If the patient has, right, non-intact airway, you want to insert no PA, make sure you know how to size it and insert it, right? And use the appropriate BVM and all that. And this here, I want to show you, right? So this is your megacode testing station. This will be basically like we're doing the megacode we're practicing right now, right? We're going through different rhythms. So here, they give you a case where, for example, there's bradycardia, then that goes into ventricular fibrillation, assisted, and post-cardiac arrest care. So it cycles through. Sometimes the way these cases are written may not make sense, meaning like it may go SVT to VFib to VTAC or whatever. The point of this is not per se to make it like medically sound in terms of like the transitions. The point of this is that you are able to perform the appropriate therapies when the rhythm changes, right? So let's say if a person goes from, you know, SVT to VFib, right? You know that, okay, we're going to check pulse, no pulse, we're going to start CPR, we're going to defibrillate and so forth. Make sense, right? Or, you know, the other way, right? If the person has all of a sudden, right, some form of an organized rhythm, right? We check the pulse. If there is a pulse, we know that we have return of circulation, and we're going to commence with post-cardiac arrest care. And there's an algorithm for that as well, right? So that you guys are aware. What I want to point your attention to here is the checklist, right? They specifically, you know, have this chest compression fraction, right? And if I show you here, this is the top portion of this list. So let me go back, right? You see this portion here of the checklist? This is what is going to be submitted for every one of you for a different case. So you may get case 2.5, you may get case 2.7, right? Or she may get case like 2.9, right? So you have different rhythms, but this top portion I just want to point your attention to right here, right? So you see how it says compressions 100 to 120, depth, chest compression fraction, there's recoil, right? And ventilations, which they say optional, but this is not optional, right? So I was basically explaining chest compression fraction to you before. Old school way of doing this is basically you run two timers, right? The start of the cardiac arrest, and the other one is when the CPR is conducted, right? In the video, they actually show you, right? So here there's a CCF, chest compression fraction, greater than 80%. And in the video, they explain how they calculate it. So they have total time, right, and the time that the CPR is conducted. Anytime CPR is interrupted, even if it's for a legitimate reason, you stop CPR to shock, let's say, right? But the moment you stop CPR, the second timer stops. Or anything else, right, during your cardiac arrest, let's say you stop for intubation or something else that's maybe inappropriate, or you're switching teammates, right? Now, we use a clock method, but now with this mannequin, there's basically the app that basically senses if CPR is done or not done, and then we'll calculate the CCF, right? And then we're going to get the number, right? So we basically actual chest compressions done, right, over total cold time. So how much time spent on the chest versus the total time, right? You have the code. So from the moment you determine patient has no pulse, to the moment they got ROSC, right? Or maybe they didn't get ROSC to the moment of termination. So that's your CCF. Here they show you 84%, right, which meets the criteria, right? And here, right, in ACLS, you can learn there's something known as a CPR coach. That role is basically for that person to continuously look at that bar that's going up and down, right, here, and basically inform, right, teammates, right, is the CPR adequate or inadequate, right? So this is a new role of CPR coach. Why do you think they created this role in the ACLS?
People weren't doing it properly?
Yeah, exactly. CPR was bad, right? CPR was not good. It wasn't done with 120 compressions, 100 to 120. The depth was poor, right? It took too long to switch, and so forth. So they created this role, right? You will see it in the videos. Basically, their job is to look at the feedback device and inform the compressor. Are they doing a good job or not a good job, right? And so this monitor has audio visual feedback. Maybe you saw like on the MRX, the hockey puck, right, that you guys are using. So what I want to show you, right? So I have two volunteers that are going to come up to do the CPR. We're gonna do the BLS, right, CPR, and I'm going to show you how the app works, and then I'm going to show you once they're done. I'm going to set it for 4 minutes. Once it's done, what is their CCF, right? So what do you guys? Let's just say, what do you think their CCF will be right now? Zero.
The hatred is
Damn,
real.
bro.
Come on. What do you think? Huh? 85. All right. So we got 85. All right. So let's see. So this is the app. This is the QCPR app, just to show you.
It's gonna be 100, bro.
So what we're gonna do is we're gonna sync the mannequin. We'll do a few compressions, right? And then once we do a few compressions, you see that this mannequin will pop up, right? It says little NU34. We're gonna connect it, right? So we are connected. And then what we're gonna do is we're gonna do CPR. So that means we're gonna do both compressions and ventilations, right? That you're gonna perform. And I said how much time? I said 4 minutes, right? So we're gonna set it to 4 minutes. You know what? Let's make it 5 minutes, just to see, right? So what's gonna happen? So 5 minutes, you're gonna do CPR.
How about 6?
No, 5 minutes is good.
Oh, you're wild.
He's gonna throw something at you in the next few seconds.
I'm gonna put this here so that you can see, right? So you guys can grab the AED, right? You could grab the BVM and from the back, and you could decide who is gonna do compressions first.
I'll do compressions first.
All right. So grab the AED, grab the BVM. You guys gonna arrive together?
Oh, we are?
Yeah. Here.
Sure.
That's what it's
Here you go. Right. So this mannequin will not accept an OPA, right? So you will not be able to put this in the mannequin. Angel, can you move back a little bit?
Yes.
You will not be able to put an OPA, so that's fine, right? So we're gonna do is this. We're gonna start right with the CPR one. We already set it for 5 minutes. So once the 5 minutes is up, it's gonna time out and it's gonna give me the report.
So I got to CPR for 5 minutes.
No, you will alternate. All right, you guys are ready? So you guys arrive to a scene. You have a patient who is unresponsive, right? And you may begin.
So, yes, I say you.
Scene and save. You got it.
Alright. Get down.
Yep.
My guy, are you okay? Are you alright?
No response from the patient.
Alright. Check for pulse.
No pulse.
Alright. It's time to.
Excellent. See how you open the shirt? Make sure you do it, right?
Alright. So at this time, I'm going to start CPR.
All right. So you see, right, the feedback device, right? So James, his depth is good, but his rate is way too fast. You see how that arrow is going all the way to the right? So he wants to be all the way in the center of the arrow,
Analyzing heart rhythm.
right?
Do not touch the patient.
And one thing I will say, when you're putting the pads on, right, you don't want to turn on the AED because it's going to start reading your rhythm.
Shock advised.
Trying to kill us. You know what I mean? It's crazy.
So turn it off, right? Put the pads on and then turn it on, right?
Yeah, I'm trying to kill. I have to put someone on this one side.
Right, so put the pads on, right? And make sure, right, we also, right, we are following our procedures with ventilations, right? So now his recoil is not good, right? You see how the arrows just go all the way
Do
up?
not touch
All
the
right.
patient.
So follow the prompts.
Oh, stop.
Shock advised. Charging. Stay clear of patient.
Clear.
Deliver shock now.
Clear.
Press the orange shock delivered. Pause. Begin CPR.
Right? So now, right, you saw one thing, when it was charging, was he doing CPR or not?
No.
Right? So that already is gonna decrease his CCF. Keep going. I'm just giving you some feedback,
I'm
right?
listening to my partner.
I'm like your CPR coach here right now, right?
Nah, my partner will say stop.
So the CPR coach, right, for that role, right, what they're gonna be doing is this exactly what I'm doing, right?
83D. It's going down.
I'm pointing out, right, so make sure you have good recoil. By the way, if you don't get good recoil, the app is gonna say not good CPR, right? If you go too fast, it's gonna say not good CPR. If you go below that number, it's gonna say not good CPR, right? So, important to monitor this, right? And you see the breaths, right? So if the breath do not go in, you reposition, right? How do you know the breath went in? That green, right, the lung area is going to light up in green, right? So far we have no no chest expansion based on the feedback device. And James, you ain't getting good recoil.
James, better recall, James. Come on. There you go.
Right? Good recoil.
There you go.
Right? So good.
There you
So
go.
you're doing a much better job, right? And by the way, when you're doing this thing, and if you're the CPR coach, you wanna basically say, all right, you wanna make sure you go all the way down, all the way up. Why? Because when we push down, that's blood flow to the heart and brain. When you recoil, that's when the heart fills, right? And basically, that's when you're supplying blood to the coronary arteries.
James, make sure you
Yeah,
go all
exactly.
the way down.
That's what she said.
All the way down,
Oh
right?
my God, I can't do that.
There you go. There you go.
Right? But what happens here? Remember, it's gonna give you a report.
Oh, yeah, I'm looking at it.
And they said 85%, right? We're gonna see if we're gonna get 85%. I said 65.
If you said 65, it's on 40.
No,
It's on 40.
we
It's
said
not letting me
85.
refresh. You might have to stop.
We're 80.
Stop the CPR.
All right.
Ah, she got the CPR now.
So switch.
Analyzing heart rhythm.
Switch.
Stay clear of patient.
Right. So, but when it says charging, what are you gonna do?
Shock advised.
He's getting ready to intubate.
Deliver shock now. Press the orange button now.
All right. So go ahead.
Shock delivered.
There you go.
Pause. Begin CPR.
All right. So pay attention to the app, right? So you wanna get good recoil, and James, you wanna ventilate, right?
Yes, sir.
And how do we know we got good ventilation?
You want to see the lungs?
Exactly. Right. So.
See, I was having the same trouble.
Good. So good CPR, right?
And
So
then
she's getting good recoil. She's also right in the center of 100 to 120 compressions per minute.
and no breath going in, Nikolai.
Yeah, it's because we have poor positioning. See, the thing is, right? When you are using a feedback device, it will actually measure what is done or not done. So there's no like ambiguity. It's not like what I felt your performance was, right? Or it's not subjective, it's objective. So I want once it reanalyzes, we're gonna see, right? And also, by the way, when they're doing their switches, right? It also takes that time when the CPR is not being conducted.
Oh, 58%. Wow.
No. That doesn't. This is not CCF. So look, right? So let me show you the report. So it says, I'm gonna save.
Yeah, you gonna put me on blast on YouTube, bro? So again.
right? So this is 58 is not the CCF.
What's
This
the
is the
CCF?
report, right? So the CCF was 79%.
Damn. Not
Right.
even 80.
But 79 is less than 80, right? So it shows you how many compressions they done. So and it says the depth was good 99% of the time, but recoil was only good for 52%.
Yeah.
Right? Breaths were 50% that went in, right? We gave some ventilations. We only gave 2 ventilations because we had poor position. Yeah, we had poor position, and we did a total of 425 compressions, and our average compressions was 87% here in
That is nothing.
in the.
No, so what you trying to tell me? I'm about to get restricted.
No, what I'm saying to you, I'm saying you're about to get restricted. What I'm saying is, right? So if it's 79 and they said you got to be greater than 80, did you pass your skill station?
No.
Right.
Negative.
What can we do to improve this to be 80% or greater?
Count the
Better CPR.
compressions.
Right. So
30
maybe,
to 2.
Is it compression
Minimize interruptions.
right, minimize interruptions. So very good. So maybe we could have done continuous compressions, right? 1 breath every 6 seconds asynchronously. Good. Then quality of our CPR, right? If our quality CPR is not good, right? If we don't get recoil, right? The CPR coach or whoever is there want to say, right? I want to see that arrow go all the way up, right? Because it's also going to calculate that. If the breaths don't go in, you want to reposition the head so the breaths start to go in. So when you're going to be tested, the instructor is going to say, let's say, all right, your mega code is going to be, let's say, 10 minutes. Let's just say, right? You're going to put it in the app. You're going to do your CPR. You're going to do your ventilations. Then we're going to get the report, right? And whatever the numbers state, that's your performance, right? So, as I said, so any confusion here, it's not what Nikolai said. It's not what someone else said. It's what you performed on the actual exam.
Nick,
Yeah.
by AHA rule, is it 30 to 2 or is it every
Yeah.
6-second breath?
So they allow right now to do asynchronous ventilations with continuous compressions, right? So if you want to start your BLS procedures with continuous compressions with asynchronous ventilations, you're more than welcome to do so. My advice to you, yes, it's a better idea. Why? Because then you have no interruptions, so your CCF will be better, right? Make sense?
Yeah.
But if you decided to do 30 to 2 and then transition once you start the ACLS, you could do that. I would personally start continuous compressions, asynchronous ventilations, right?
Nick,
Yeah.
what exactly, like, are we going to be the team leader?
Yeah.
Making sure that everything is being done right, or are we actually doing it?
No, you're going to be the team leader, and you're making sure your teammates are doing the stuff correctly. And obviously, right when you switch roles, someone else is going to be the team leader, and someone else is going to be doing compressions. So all of you are working together to pass, right? And when we do mega codes, right, what do I tell you guys? Work together, talk to each other, right? Use your protocols. For ACLS, you're allowed to bring your books if you got. Anyone has that AHA ECC book that I said to buy?
Yeah.
And someone, yeah.
How about at home?
Yeah, so bring that book. If you have the actual ACLS book, bring that book. If you have those cards they put in the book, bring those cards. You're allowed to use it. You're allowed to reference it. You're allowed to talk to each other, right? So, as a team, right? Talk to each other. Utilize, right? Don't try to sabotage each other, right? Don't do bad CPR, right? So that your, teammates fail, right? Do a good job. And then, right, we're going to get a report. We're going to switch roles. Someone else is going to be the team leader, right? You're going to have a different case maybe, right? I showed you different cases. But the check marks are all the same, right? Is this clear? Right? Any questions, ask me now, right? So what you should be doing when you go home today?
Reading.
Well,
Making your account.
make an account, go to the link, make an account, start watching the videos. By the way, it saves your progression. Let's say you only done up until let's say, halfway through, it will save your place, so you return to do it, right? My advice to you, watch it a few times, right? Do the test until you get 100, do the same thing for PALS. Print those certificates, right? Make sure you got them, and you bring them to the day of the class, right? You already done all your pre-course work. So everyone who is here, you're already, one step above, right, everybody else, right? Any questions? No? All right.